Every year, millions of people over 60 walk into clinics and hospitals for their annual health checkups. They trust the process, they follow every instruction, believing that modern medicine has their best interest at heart. But what if I told you that some of these very tests, the ones meant to protect you, could actually increase your risk of stroke? Sometimes within just a few days. It sounds impossible, doesn't it? After all, these are the same tests prescribed by trusted doctors, backed by science, and performed in sterile. But the truth is, the human body, especially after 60, reacts differently. What was safe at 40 can quietly become risky 2 decades later, and the danger isn't dramatic, it's subtle. It hides behind words like routine, preventive, or standard procedure. Imagine walking out of your doctor's office feeling reassured, only to experience dizziness or blurred vision a few days later. You think maybe it's just fatigue or dehydration, but sometimes it's not. Sometimes it's the aftershock of something your body wasn't ready for. That's what we're going to talk about today. The hidden side of medical testing that no one warns you about. And more importantly, what you can do to protect yourself. Let's begin with one of the most common procedures, the CT scan with contrast. It's a standard imaging test that uses a dye injection to help doctors see your blood vessels and organs more clearly. The moment that contrast enters your bloodstream, you might feel a warm flush through your body. That's normal. But what's not often mentioned is how this same contrast can quietly stress your heart and blood vessels. Especially if you're already dealing with high blood pressure, heart disease, or kidney issues. For many older adults, the reaction is mild eye dizziness, nausea, or a faint feeling, but for some, blood pressure can surge suddenly. Those delicate vessels that have already weathered decades of wear may constrict or spasm. And that's when trouble begins. A study once found that seniors undergoing contrast-enhanced CT scans were significantly more likely to experience vascular complications within 72 hours. In simple terms, the test can sometimes wake up problems that were sleeping inside you. Here's a real example. An 81-year-old man went for a routine abdominal scan because of minor digestive discomfort. Everything looked fine, and he was sent home. But 2 days later, he suffered a minor stroke. Doctors suspected the temporary rise in his blood pressure from the contrast injection caused a small clot to travel to his brain. Thankfully, he recovered. But that moment changed everything he thought he knew about safe medical tests. Now, let's move to another familiar name, the stress test. You've probably heard your doctor mention it at least once. You get hooked up to a monitor, start walking on a treadmill, and the machine records how your heart performs under pressure. Sounds harmless enough, right? But after 60, things work differently. The same exercise that's manageable for a younger heart can overload an older one. During the test, your blood pressure can spike. The arteries that have stiffened over time suddenly face intense demand. If your system isn't ready, it's like shaking a fragile bridge in a storm. In rare but very real cases, this sudden stress can trigger small tears in blood vessels or cause temporary blood flow disruptions in the brain. One study followed more than 1,000 patients over 60, 5 who took treadmill stress tests. Around 7% experienced harmful events like irregular heartbeats or blood pressure spikes. 7% may not sound like much, but imagine sitting in a room of 100 seniors. 7 of them could face complications from a test meant to protect them. There's a story that still stays with me. Margaret, a 74-year-old woman from Ohio, went in for a stress test. She'd had high blood pressure for years, but otherwise felt fine. Halfway through, she became dizzy and had chest tightness. They stopped the test, and she seemed okay, until the next morning, when she suffered a mild stroke. Doctors later said that the intense pressure during the test likely ruptured a tiny vessel in her brain. The test didn't cause her stroke directly, but it pushed a vulnerable system too far. The takeaway here is simple. Always ask if a stress test is truly necessary for you right now. If you're not experiencing chest pain or shortness of breath, sometimes a resting echocardiogram or a medication-based stress test is safer and just as effective. Now let's talk about a procedure that's become routine after 60, the endoscopy. Whether it's a colonoscopy or a scope of your stomach, it's often recommended, just to be safe, and often, it makes sense. But when sedation is involved, and especially when you're taking blood thinners like aspirin or warfarin, things can get complicated. During sedation, your blood pressure naturally drops, and your circulation changes. Combine that with medications that affect blood clotting, and suddenly, you have the perfect setup for a small but serious event, a transient ischemic attack or mini stroke. In 2021, a large review found that older patients who underwent sedated endoscopies were significantly more likely to experience mini strokes within 3 days. The symptoms were subtle slurred speech, confusion, or unsteady movement. But they were warnings, signs that blood flow to the brain had briefly faltered. One 76-year-old woman experienced exactly that after a routine colonoscopy. She had no issues going in, but 2 days later, she was rushed to the ER with mild stroke symptoms. It turned out the combination of sedation and her daily aspirin had temporarily disrupted her brain's circulation. That's why you should never hesitate to ask your doctor, is this procedure urgent? Can it be done without sedation? Or, do I need to adjust my medications first? These questions might sound small, but they can make the difference between a smooth recovery and a dangerous reaction. Let's turn now to MRIs, one of the most advanced diagnostic tools in modern medicine. They can reveal hidden problems deep within your body. But when contrast dye is added, particularly one containing gadolinium, older kidneys may struggle to flush it out. What many don't realize is that gadolinium can linger in the body, especially if kidney function has declined with age. Over time, traces have even been found in the brain and other tissues. Though rare, it's been linked to a condition that causes the skin and connective tissue to harden, and in some cases can affect mobility and organ function. In 2019, researchers followed over 2,000 older adults who had contrast MRIs. Within a week, around 5% reported temporary neurological symptoms, dizziness, headaches, blurred vision, not full strokes, but signs that the brain's circulation may have been stressed. That's why it's so important to ask for a kidney function test before any contrast MRI. It's a simple blood test, but it can help prevent serious complications. Finally, let's talk about one of the most misunderstood tests, the carotid artery ultrasound. It's quick, painless, and seems completely safe. Doctors often recommend it, just to check the arteries that supply blood to your brain. But here's the catch. Sometimes these tests lead to unnecessary surgeries. If the scan shows mild or moderate narrowing, many people are told to undergo a procedure to clean out the artery. Yet, research shows that in patients without symptoms, surgery doesn't always reduce stroke risk significantly more than medication and lifestyle changes. And in some cases, the surgery itself can trigger a stroke. An 82-year-old woman named Helen learned this the hard way. Her scan showed narrowing of 65%. She felt fine, but her doctor wanted to act quickly. During surgery, she suffered a small stroke and has lived with partial weakness ever since. She later said, "I wish I'd known that waiting and monitoring might have been safer." So here's the real takeaway after 60, your body deserves not just care, but caution. Every scan, every test, every injection should be tailored to your condition, not to a checklist. The point isn't to fear medicine. It's to understand it, to ask questions, to know your numbers, to know your body. Before any test, take a breath and ask, is this essential? Is there a safer alternative? Because your health isn't about doing more, it's about doing what truly matters. At the end of the day, knowledge isn't just power. It's protection. It's what helps you walk out of every appointment with confidence, not confusion. Your health is in your hands, handle it wisely.